Our health undoubtedly is on top of everything. Therefore, it is of prime importance for all of us to have a very good care of our health. For these reasons, having doctor's visits, going for regular medical checkups, followed by the required treatments, and also gone through with some surgeries in operating room, we all are one way or the other associated with this healthcare journey. Patient needs healthcare setup, and that is the hospital. Hospital comprises of many factors to make sure that the patient gets complete and better care. And those factors are the hospital building, the hygiene of that building, the doctors, the paramedical staff, and of course the medicines. These are very critical not only for the patients but for the caregiver too, in order for them to be more competitive and successful in this healthcare industry. But having said that, no healthcare setup is complete without another factor which is huge and indispensable, and that cannot be ignored or left out by any means. That is the healthcare technology. Healthcare technology, the clinical or biomedical equipment. Whenever we go to a hospital, we find so many equipment around. These equipment are nothing but the technology I'm talking about. These systems are there to assist doctors and their team to get the treatment done for their patient. And to your surprise, there are some health conditions, the treatment of which is not possible if some special equipments are not there in the hospital. That means some special equipments are needed for some critical conditions and for their treatment to be present in the hospital. So, in a nutshell, for any healthcare infrastructure, having complete range of clinical or biomedical equipment is not an option anymore, but it is a requirement or the necessity for this hospital in order for them to be surviving in this modern era of technology. Today's standard of quality in healthcare, especially in the diagnostic and therapeutic approaches, wouldn't have been achieved had not this technology been introduced many decades ago to a health sector. And for the last few decades, this area has improved tremendously. And the good news is that it is evolving and evolving so rapidly. Hi there, my name is Zahid Siddiqui and I am a Healthcare Technology Management HTM professional. I welcome you to my channel, the HTM Compass. This channel will mainly be focusing on clinical or biomedical equipment, which is the part of healthcare technology. Hope this channel will be more informative and insightful for you all. The channel HTM Compass, a series of videos. Each video will have a separate piece of biomedical equipment to give basic introduction of and to talk about their application and how they are used. The intended viewer of this channel are expected to be the fresh biomedical engineer, the medical student, the candidates who are going to make their career in healthcare industry, and of course the patients who have the curiosity to have insights on different medical equipment sometimes they are connected with when they are there in a hospital to get their treatment done. So now let's come towards the topic today. As I told you, each video will have a separate topic and a separate piece of biomedical equipment to talk about. So today's topic we have with us, that is the blood pressure monitoring. So let's start with this video with today's topic. Blood is the main component of a human body. The hemodynamics of a human body should always remain up to a required level. So the parameter of it should regularly be monitored in order to have our body functioning well. Among all other parameters, the blood pressure is very easy and convenient, and it's very handy to be carried out. Whenever you go to a hospital, the OPD, the doctor's office, the operating room, the emergency room, and the ICUs, all over we find the blood pressure is the main thing which is done first of all. Before we move forward, there is one question which comes to our mind, and that is, what do we really look at when we go through this process of blood pressure monitoring? Well, the answer is systolic and diastolic pressure. Systolic pressure is the pressure of blood exerted on the wall of artery, and this systolic pressure is measured near the end of the cardiac cycle when the ventricles are contracting. Whereas the diastolic pressure is again the pressure on the wall of artery, but it is measured at different time. This is measured when both the ventricles are filled with blood and the cardiac cycle is about to start. The ideal systolic and diastolic pressure of a healthy person in a resting positions are 120 and 80 mmHg. Normally, the blood pressure is measured in millimeter of mercury, and that is mentioned in mmHg. So now let's talk about the different ways through which the blood pressure is monitored, and those are the invasive blood pressure monitoring and the non-invasive blood pressure monitoring. Let's talk about the invasive blood pressure monitoring first. The invasive blood pressure monitoring is the procedure that monitors the arterial pressure by directly interacting with the blood in the artery, and that artery is the radial artery. That is done through a cannula needle that is inserted through skin to artery via palpation or with the help of ultrasound imaging. The other end of the cannula is connected to a fluid-filled system, and that fluid-filled system further connected to a pressure transducer. That pressure transducer converts pressure into an electrical signal, and with the help of some algorithm, it tells the arterial pressure on the physiological monitor. The invasive blood pressure monitoring system is believed to be the most accurate system, and it is known for its beat-by-beat blood pressure monitoring technique. This cannot be performed anywhere, but it is performed only in the ICUs and the operating room, just because this system being little complex and requires some expert supervision. The non-invasive blood pressure monitoring system is a very common system and requires a less skills as compared to that of invasive blood pressure monitoring, and it is not restricted to be in the hospital setting only. It can be performed anywhere, anytime, within a couple of minutes. Non-invasive blood pressure system is subdivided into 3 different techniques. Those techniques are the palpation, auscultatory, and the oscillometric. Palpation is the technique to get the estimated minimum value of systolic blood pressure. This technique is used in an emergency situation. For getting the more accurate results, we must use the sphygmomanometer, palpating the radial pulse. And this system does not yield out the diastolic pressure. Auscultatory technique is very common and most preferred method under the non-invasive blood pressure monitoring. This method, with the use of mercurial sphygmomanometer, has been the gold standard in hospital setting and in the clinical trial. The auscultatory method is believed to be reliable for clinical measurement of hypertension in high-risk patients. The auscultatory method requires some instruments and the accessories to get this blood pressure monitoring done. And those are the sphygmomanometer, the stethoscope, the inflatable cuff, and the rubber bulb. The inflatable cuff is wrapped around on the upper arm, and it is kept on the same vertical height of the heart. There are 2 tubing with this inflatable cuff. One goes to rubber bulb and another goes to sphygmomanometers. The rubber bulb is squeezed repeatedly in order to inflate the cuff, and when the cuff pressure reaches to the same level of arterial pressure, it occludes the arteries, and there is no blood flow at all. Now we place diaphragm of the stethoscope on the brachial artery, just in between the elbow line and the bottom of the cuff. Now the cuff pressure is slowly released in order to reopen the arteries, and when the point reaches, the arteries starts opening and the blood starts flowing again. But that starting of blood flow creates some sound, the tapping sound, which is heard by stethoscope, and that sound sometimes called Krotkoff sound. The releasing of cuff pressure is still kept going until the tapping sound is heard and the blood flow becomes laminar. Exactly at the time of laminar flow, we have to check and record the pressure in the cuff. and that pressure is nothing but the diastolic pressure. So with this technique, we have both the pressure, systolic and diastolic pressure. But this technique requires little expertise, and that can be done at the hospital setting only. The oscillometric technique of blood pressure monitoring uses maximum volume change as an indication of average value of systolic and diastolic blood pressure. This average is combined with the rate of change of pressure, and with the use of electronic system and its algorithm, the systolic and diastolic pressures are estimated. Whenever we have an electronic system which is based on oscillometric technique of blood pressure monitoring, that system has got the cuff which is automatically inflated, and it is inflated to an extent the arteries are completely blocked and there is no flow of blood at all. When the pressure is further released, the blood starts flowing again, and at that point the pulse wave creates a limb volume changes, and that limb volume further changes the pressure in the cuff, and that change in the cuff pressure is monitored by the machine by the pressure transducer, and with some algorithm the systolic and diastolic pressure is measured. Apart from all the methods and technique we have already discussed in this video for blood pressure monitoring, there is one more technique which is now in trend these days, and that is photoplethysmography. Photoplethysmography measures the volumetric variation in the blood circulation. The photoplethysmography is the technique which uses the infrared light. That light passes through the skin to bone, to tissue and to the blood. And with the characteristic of absorption, these tissue absorb light and the remaining light is reflected back to the device on the skin. So this is the time to wrap up my video now. And if you have liked this video, please press the thumbs up button. And if you have not yet subscribed my channel, please subscribe now. And please don't forget to press the bell icon so that you are intimated whenever the new videos are released. So I'll take leave now. I'll see you in my next video with a new topic and a new piece of biomedical equipment to talk about. Until then, I wish you all have a nice time with your families and friends. Bye bye.